because a lot of fear is there out there about cancer being caused by hormone replacement therapy. And the reason it came about was from the WHI study, where they found that there was an increased risk of getting breast cancer, strokes, liver problems and clots and things like that. So, but then the hormones that were used were synthetic hormones, and that was never told to the public. So the people usually think that the hormones equal cancer. But when we do bioidentical hormone replacement therapy, we're using the hormones that are natural to the body, which means they're human hormones. They're not synthetic coming from animals or anything like that. It's actually human hormones. The second part of that story is that we also monitor you very closely for any kind of aberrant metabolism that would put you at higher risk for developing cancer. And there are certain metabolites. Metabolites means the broken down products of the hormones that are associated with a higher risk for breast cancer. So when we have patients and we're treating them, we actually check that to see what your metabolism is and what is your metabolites of the estrogen. There's particular metabolites that increase the risk of cancer, and there's particular metabolites that lower the risk of cancer. So we check all of that, and if there is an increased amounts of the metabolites that are associated with cancer, then we give them natural supplements to lower that risk. So either way, you walk in and you get treated, it's better chance for you to avoid cancer, because you will also find out that whether it's genetically or inherently your body is at higher risk, you will find that out. So if you were to do nothing about it, and you might have, because the metabolism changes as a person is getting older. So when a person is younger, their metabolism goes more towards the metabolites that are protective of breast cancer or endometrial cancer or ovarian cancer. But when the person is older, and that's why you see more cancers when the person is older. When a woman is over 50, there's increased risk of breast cancer. So, and the reason is not the hormones, the reason is the metabolism has changed, and that is what is putting a woman at higher risk. So when you come in, so you get two things done. You actually balance your hormones, and you also find out what your metabolism is. Whether it was because of the hormones or it was already there before, then we can change that. So, and using everything natural, we don't use any drugs.